Thank you, Gary and Kate, for inviting me onto your YouTube channel today. My name is Megan Jordan and my current role is a clinical nurse consultant for wound and stoma care in Broken Hill, and Broken Hill is part of Far West Local Health District. So I've been in my role for about 5 years as a CNC, and I came to Broken Hill in 2015 actually for a 6-month rotation, and here I've stayed. So I'm really enjoying the role. My role is not only here in Broken Hill, but it extends out across our other 8 rural and remote sites. And my position is obviously consultancy with patients and our staff to provide wound and stoma care. But also I have the full 5 domains of a CNC. I really enjoy my role here and I really enjoy the community that we live in. So what would be my specialty area or area I enjoy the most in wound care? I would have to say that it would be chronic wounds, and I know this is a big subspecialty area that entails a lot of types of wounds, but I really enjoy this cohort of patients and their families because it's quite challenging. You need to work with the multidisciplinary team, which I find really rewarding. And in a small community here in Broken Hill, you know, everyone knows everybody and we all work really well together. When someone's got a chronic wound, often they've had it for a very long time. I've had patients that have had wounds for 5, 10, 15 years. And by the time you see them, they feel like there's no hope. They feel like there's never any chance of this wound healing or even improving. And then when you really sit down and talk to the patient and their family, and find out what's important to them, find out what their goals are, and work together on that. Hopefully you can put in a plan with them that either sees their wound improving or sees their wound heal. So I would say that this would be my area that I enjoy the most, my subspecialty area, because of those reasons. So if I was to give some advice to a new graduate, nurse or allied health professional, I think I've had to think about this question. I think I'd break it down into 3 key messages. And the reason I would do this is because I think that there's a lot of messages that are sent towards new graduates. There's a lot of information overload. And often when they go through their undergraduate degree, there's not a lot of wound care that is delivered in those programs. So when they graduate and come out into the world of nursing or allied health, it can be a little bit scary, especially around wound care. So I would say my 3 tips would then be, keep it simple. Definitely keep it simple. And what I mean by that is keep the wound care simple. Don't overcomplicate it. When you're looking at dressings, it can be very overwhelming with different types of dressings. Or different brands is what people get mixed up with. So I'd say look at the type of dressing. That is a really good thing, especially if you're going from different settings or different health services where they use different brands. Look at the type of dressing. So what I mean by that is looking at, you know, is it a foam? Is it a hydrofiber? Is it an alginate? That sort of thing, and not actually looking at the brand name because then it can be very confusing. So that would be my first tip. Keep it simple and choose the best dressing, not because it's what was on the wound prior, not because that's what you like or what so-and-so likes, but choose the dressing because it's best practice for that wound type. My second tip or advice would be always be inquiring. So what I mean by that is always ask the question why. Be like a bit of a 2-year-old really, and always ask, you know, why do I need to do this? Why is this dressing chosen for this wound? Why is this wound not healing? Why, you know, if we keep asking that question and keep inquiring and keep looking at the research showing what it's telling us, keeping up to date, as I say, with your knowledge and skills, you know, this can lead you into learning and developing your skills along the way. You're not going to come out of university and know all there is to know about wound care. It's something that you need to develop and every day should be learning. There's not a day that I don't go to work and see something or learn something new. So yeah, always have that inquiring mind. My third tip would be look at the patient. So often we get caught up on the wound, but we need to look at the patient first. So walking into the patient's room or their home, greet the patient. It's often that we're looking at the wound and not actually at the patient and talking to them first and getting their history. They've lived with this wound often, especially in our chronic wounds, for a very long time. They know the wound. You could get a whole heap of information before even taking the dressing down. So really engage with the patient first. That would be my tip number 3. Patient story that would come to mind. I wouldn't say that there's one story that stands out. There's lots of patients that I've worked with along the way that I think of that have had some really good outcomes. And I think using collecting patient stories, we do here in Far West, we use a method of appreciative inquiry, and this really allows us to explore the care that patients have been provided, what's important to them, and see, that living in a community like this, we can see our patients out and about and see them, living in the community and getting back to their daily life. That's what's really rewarding, and that's what's the standout for me, is just seeing people getting on with their life after they've had, a pretty horrible experience of dealing with a wound. I wouldn't say there's one sort of thing that stands out. I think I'd put it into a collection of advice or things that I've heard, and it would be when clinicians choose dressings because it's what they have used before and it's worked well, and not actually doing a full wound assessment. I think that's when advice can go wrong, when decisions are made that aren't best practice and aren't evidence-based, that they're made without the skills and knowledge to make sure that the best plan is put in place. So if I had some time to sit down with a politician and talk wound care, what would I say? First of all, I would say thank you for the wound consumable scheme. I think this is a really good start and a really good step in the right direction for wound care. It needs to be grown upon and continued for it to be the complete package, basically. I would also say don't forget healthcare needs to be equitable. So living in a rural, remote area such as Broken Hill here in Far West Local Health, it is often difficult because of our geographical location to get the same services that our counterparts in city hospitals can get. So I would say, remember to keep the healthcare equitable, keep the funding equitable, make sure that the pathways that we have are accessible and achievable as well. So I think that would be probably the most important thing coming from the setting that I'm in at the moment, to make sure that these things continue and to make sure that healthcare is spread evenly across all areas.